full expense of that procedure. That procedure cost around 12 lakh only for the stents and everything. Then we did that procedure, and I also took my senior's help. His name is Dr. Bhandekar. He is in Lilavati and Global Hospital, Mumbai. Then we did that case, and patient 3 days before, patient got completely discharged. Yesterday I talked with him. He is perfectly fine, no pain, nothing, and he is happy.
बेजिकली हो पेशंट आमकां लोकांक सांगूंक जाय आशिल्लें की ही जी फॅसिलिटी पयलीं नाशिल्ली गोवा मेडिकल कॉलेजान, आतां विथ दी हेल्प ऑफ अवर ऑनरेबल हेल्थ मिनिस्टर, our chief minister and all the government support, we are doing this kind of cases. आता हीच जर केस बॉम्बे गेल्ली जाल्यार खंय ना म्हटल्यार ताका एक 40-50 लाख खर्च येवपाचो, प्लस बॉम्बे वचप लॉजिस्टिकली खूब कठीण आसता. आनी ही अशी केस जो कोण आमचे कडेन कन्सल्टंटूय आयिल्लो ताका हेल्प करपाक असिस्टंट म्हणून, ताणें सुद्दां म्हटलें की असले केसी बॉम्बेन सुद्दां व्हेरी रेअरली जाता. आनी तो पेशंट गरीब फ्रॉम सावथ गोवा, ताचें नांव सांगूंक सोदिना हांव कित्याक सांग तें पब्लीक जातलें. आनी त्या मनशाक तर ही वॉज सिटींग ऑन अ वॉल्केनो, म्हणजे कळ्ळें न्ही तुमकां, ताका इतलो डेंजर आशिल्लो लायफाचें. आनी ताका आमी तो स्टँड जेन्ना आमी गव्हर्मेंटाक बरयले तेन्ना गव्हर्मेंटाक आमी बरयतना आमची मेडिक्लेम स्किमीची अपर लिमीट आसता 3 लाख आनी हे स्टँटाक पडटले 12 लाख. 12 लाख हांवें ताका कितें म्हटलें की मनशाच्या लायफाची व्हॅल्यू आमी करूंक शकचे ना. So we approached Honorable Health Minister, and he also approached and he explained the minister. Minister from his personal interest took this file so quickly and आमकां ते 12 लाख सँक्शन जाले. मदीं आमी ते सँक्शन जायसर त्या पेशंटाची आमी खूब क्रिटिकल केअर घेतली टू कीप हिम अलायव. आनी तो बरो उरलो आनी ताणें 3 दीस फाटीं ती केस केली. आमकां पेशंट सारको घरा वचसर ते डिक्लेअर करपा नाका आशिल्लें. Today patient has gone home, discharged, he is well, he is perfectly fine and he is living his normal life. So what we want to give a message that Government of Goa is doing everything to see that people get free services at Goa Medical College, and this is a branch called as interventional radiology which can be utilized now for all kinds of vascular problems, all kinds of we have also got one more person who does stroke patients. His name is Dr. Bhandekar, Sanat Bhandekar. He is also doing what is called as an advanced kind of treatment for vascular lesions, especially stroke patients. And then we also started coiling in the patients who get these aneurysms in the brain. Now these are differently treated in neurological vascular conditions, whereas other vascular conditions we have Dr. Pawan Kumar who is doing it in the Department of Radiology, and this is known as interventional radiology.
Doctor, तुम्ही आता सांगले एक पेशंटाक 12 लाख झाले, पण ते गव्हर्नमेंटान सेक्शन केलं. पुढे जर अशो केसेस येत जाल्यार मागीर कशें कितें?
आमच्याकडे आता ऑलरेडी अनेक 2 केसी आसा. वी आर गोइंग टू अप्लाय अगेन टू दी गव्हर्मेंट. सी दीज आर रेअर केसीस and तांचे लायफ इज व्हॅल्युएबल. सो वी वील फॉलो दी प्रोसिजर. वील गेट अ प्रायर अप्रुवल ऑफ दी गव्हर्मेंट बिकॉज अजून ती मेडिक्लेम स्किमाची जी हे आसा ती अपर लिमीट एक 3 लाख आसा. and in special cases like bone marrow transplant, government I think is giving 8 lakhs. So हे खंय तरी आमी हळूहळू गव्हर्मेंटाक बरोवन we might request the government to increase this mediclaim ceiling to what is special cases. Correct.
Cat lab for radiology. Cat lab for radiology.
Doctor, you mentioned about 7 other cases. So
Yeah.
on the department you said is functional for that the new unit is functional for a while, right?
So
3 years you said.
yeah, correct. So he has joined us about 3 years back. 3 years आम्ही आता ह्यो असल्यो केसी करता. आता ही पळय ताणें 7 केसी म्हणटा दे आर ऑफ द ओवटा, सो दे आर व्हेरी कॉम्प्लिकेटेड. पण बाकीच्यो केसी आसा त्यो दे आर नॉट सो कॉम्प्लिकेटेड. लायक ही इज वेल ट्रेन टू डू ऑल दोज केसीस. सो त्यो केसीस आमी तेन्ना तुमकां सांगूंक ना, पण आतां आमकां दिसलें की
आता मेन्शन केलं न्यू म्हणून म्हाका मातशें कन्फ्युजन जालें. न्यू आनी ओल्ड म्हणून हांवें तुका
ना. सो आमी आतां 3 वर्सां जाली असल्यो केसीस करता, तरेतरेच्यो केसीस करता. सो आतां ह्याच तेंपाक आमी तो ओवोटा स्टार्ट केला. ओवोटा हो आमी पयलीं करनाशिल्ले कित्याक दे आर व्हेरी कॉम्प्लिकेटेड केसीस आनी द एक्सपेंडिचर इनवॉल्व इज व्हेरी ह्यूज. सो आतां विथ डीन, with the minister taking very active interest in all this, असल्यो केसी आमी घेवंक लागल्या. इनफॅक्ट आतां पळय इनिशियली न्ही एक डॉक्टर आसा बॉम्बेचो, इज एन एक्सपर्ट सामको. म्हळ्यार इन इंडिया देर बी व्हेरी फ्यू पीपल हू डू दीस केसीस. सो तो येतालो आमकां हेल्प करपाक. तो येतालो आनी तो हाजे बरोबर रावन तो दोगी जाणां मेळून ती केसीस करताले. आतां नाव ही इज ऑल्सो गेटिंग ट्रेन्ड टू डू दीस केसीस इंडिपेंडंटली, बिकॉज दे आर व्हेरी कॉम्प्लेक्स. आनी आमी पळय तकले वापरता ते इन्स्ट्रुमेंट्स ते सामके एक्सपेन्सीव. न्ही तुवें तो स्टँड आसा तो तुवें मोडलो समज वाट लागलो जाल्यार 5 लाख रुपया गेले 10 लाख रुपया गेले तशें ते. सो तो येता आनी ते दोगी जाणां म्हणटा लास्ट केस तांणी केल्या ताका 8 वरां लागली. हाव मेनी आवर्स इट
Time, total time from 8 hours.
8 hours लागली ताका ही केस करपाक. म्हणजे इन द कॅथ लॅब. दीस केसीस आर डन इन द कार्डिओलॉजी कॅथ लॅब. कळ्ळें न्ही. सो अगेन तांचो हेल्प लागता आमकां. सो डिपार्टमेंट ऑफ कार्डिओलॉजी, डिपार्टमेंट ऑफ कार्डिओथोरॅसिक सर्जरी, डिपार्टमेंट ऑफ एनेस्थेसिया, हे सगळे डिपार्टमेंट्स लागता. आनी ऑफकोर्स विदाउट द डीन हे इम्पॉसिबल, कित्याक सो मच ऑफ फायनान्शियल सपोर्ट इज रिक्वायर्ड.
Basically,
After 8 hours, like, when did the patient go home now?
patient
Patient
is
already went.
today,
Yeah,
no?
but after how many days?
I kept that patient for 3 days to observe.
3 days. Yeah.
If it was in surgery.
Open
and
surgery, it would have been some 80 stitches and all, and morbidity. Plus, there is a lot of risk in this because, as Dr. Sanjay said, aorta, you cannot play with aorta. Aorta is a main vessel. If it ruptures, you will have no chance to stop bleeding. And earlier, these aneurysms was like, death sentence. But today, we have a facility which can also be, so safe. And through that technique of intervention radiology, Dr. Pawan is doing a lot of good work. He is also doing a lot of work in diabetic foot, diabetic gangrene, also in tumors. आता एक जर ट्युमर जाला आनी ताका जर धाकटो करूंक जाय, श्रिंक करूंक जाय जाल्यार तो ते ट्युमर वेसल ब्लॉक करता. So all this has come after he has joined us, and this is becoming really a complementary for all the specialties आमचे जे आसा GMC to help them in treating the patient.
When are you going in the super specialty full-fledged?
Super specialty, we have already started OPDs. There are few wards also started, and once we get our installation of CT scanner, which is in process, we will go there. We are just waiting for some equipments to come there.
And there was this genetic OPD was started, no? And then it was stopped. What happened?
No, genetic OPD was under that Dalal, Ashwin Dalal. Now, Ashwin Dalal has some commitments for few months. Till that time, he said he will not be able to come, but OPD is still there.
But who is conducting it himself?
No, we used to always send the samples to him in Hyderabad. So there is a person who collects the samples from our HP lab, that is histopathology. There is one more lab we started for organ transplant. There we have trained one person to collect these samples.
कोविडाचे कशें कितें सध्या प्रिपरेशन जालां कारण आमी पळयता की गोंयांत क्रावडूय खूब येवपाक लागला न्यू इयर आनी हेजे खातीर बाकीच्या कंट्रीजांनी वाडपाक लागला कोविड.
कोविडाचे सिच्युएशन म्हणजे त्या दीस गेल्या फ्रायडे Honorable Chief Minister was chairing one state level meeting with Honorable Health Minister. We all were there. Now this is just a speculation that we might get a spike. We might. And अशें speculation असता तेन्ना where what we should do, we should be remaining prepared for everything. So there was a mock drill on 27th by Health Secretary. And as per that mock drill, we have given all our preparedness charts to the government. Because BF7 is supposed to be little highly infective, which is now circulating in every country. आता सध्या तुम्ही पळयल्यार लोकांक कोणूच मास्क वापरिना आणि लग्नाय भरपूर चल्ल्यात. तुम्ही तरी जाणा कितली लग्नां चालू आसात ती, कितलीशीच पार्टीज चालू आसात. So people right now, they feel that they are out of all this. But somewhere if somebody reminds you, Baba, in China cases are increasing, we should not remain negligent. We should always take precautions. कळ्ळें न्ही तुमकां. आतां हे सगळे फेस्टिवल्स आनी हे चालूच आसा पळयलें न्ही. आतां न्यू इयराक सुद्दां तुमकां एज ही सेड लॉट ऑफ इनफ्लो ऑफ टुरिस्ट विल बी देर. बट वी से दॅट इट इज एडवायजेबल टू वेअर अ मास्क वेन यू गो इन अ क्राउडेड प्लेस फॉर युअर personal protection. We are not saying it is that it will come. So best thing is you Even